Welcome to the Hawaii State Center for Nursing's Enduring Continuing Nursing Education activity related to well-being of Hawaii's nurses during the COVID-19 pandemic. I'm Carrie Oliveira. I will be the presenter during this presentation. This is an enduring recording, so it will be available on the Hawaii State Center for Nursing's YouTube channel through January 10th of 2023. Please note that this presentation was previously recorded. Originally, this was a live presentation given on December 14th, 2021 to a live audience. The last part of the presentation does include the discussion that occurred during that presentation and is part of the enduring materials content. In order to earn continuing nursing education for this activity, participants must watch the entire recording and complete an electronic evaluation, which is available on the Hawaii State Center for Nursing's Continuing Nursing Education webpage, which will be linked in the description of this video. Any questions or technical difficulties you have should be mailed to Hawaii State Center for Nursing's email address at hscfn@hawaii.edu. You'll note that there will be continuing nursing education information provided as part of that live presentation. Note that these instructions supersede those provided in the live presentation. We appreciate you paying attention to this, and we look forward to your feedback on the evaluation. Please enjoy.
And welcome to what I'm pretty sure is the Hawaii State Center for Nursing's last webinar of 2021. My name is Carrie Oliveira. I am the Nursing Workforce Researcher at the Hawaii State Center for Nursing, and it is my great pleasure to give this.
Hello.
Hi, welcome.
Thank you.
It's my pleasure to give this webinar on well-being of Hawaii's nurses during the COVID-19 pandemic. And I've been wanting to give this webinar probably since we finished collecting the supply survey data. So I'm very excited to talk about these findings. So before we get into actually the content, a couple of housekeeping things for you all. First, I keep trying new stuff for engagement during these webinars. So I'm trying the Q&A thing with Google today. So if you are interested at any point in submitting a question related to the content, I would invite you to click at the link in the chat. Go ahead and drop it there as we go. If I see a question that's apropos, I'll try to bring it in. Otherwise, we'll try to get to them at the end. If we don't get to all of them at the end, when we send out the link for the evaluation by email, I'll do my best to address any unanswered questions at that point. The other housekeeping stuff I have to attend to is that this is a presentation for continuing nursing education. So I've got to do all the relevant disclosures on that. So the Hawaii State Center for Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. Nothing on earth has more syllables than that. And the Hawaii State Center for Nursing designates this activity for a maximum of 0.5 contact hours. For those of you who are bad with decimals, that's 45 minutes. In order to receive proof of participation and completion of this activity, you will have to participate, obviously, or listen to this webinar. You will claim credit commensurate to your participation in the activity and also complete an online evaluation form. The online evaluation form will be sent to you via email, probably sometime tomorrow morning. We'll also include with that the slide deck from today's presentation. So that'll be available for you. If you were registered prior to 1 o'clock this afternoon, you should have gotten the information sheet related to this activity. If you need that, please let us know. And our intention, if I do my job well today, is that there are 3 things I hope that you guys come away with more than anything else. That by the end of this presentation, that you're able to describe how COVID-19 affected the well-being of Hawaii's nurses. If you can identify one or more differences in the well-being of Hawaii's nurses based on their primary employment settings, there's a lot of really interesting information about that. And then finally, summarize how the well-being of Hawaii's nurses influences workforce retention, then I will consider myself to have done a good job. And of course, you can tell me whether or not I did when we send that evaluation. We really take those data to heart. So we really hope that you complete the evaluation, even if you're not trying to claim continuing nursing education credit. All right. So I just want to kind of jump in and first talk about why we need to be concerned with clinician well-being. And clinician, I'm talking about nurses because that's what I do. But this is really about the health and well-being of the workforce, the health workforce in general that we need to be worried about. So well-being, generally speaking, is a state of enjoyment, engagement, fulfillment, and joy that you experience as a result of doing your job. When we start to see that get diminished, we worry about our nurses, right? That the experience of well-being is ultimately protective against burnout, which is a point at which you're like, I don't have the wherewithal, I don't have the emotional, psychological wherewithal to continue doing this job. I don't have it in me to give anymore. The job has taken more of me than I have to give. That's problematic, both because we're worried about nurses as human beings, but also because there are downstream impacts related to patient outcomes, as well as workforce retention and stability. If you get to a point where you don't want to do your job, you're not incapable of doing your job anymore, that causes nurses to leave the workforce. And we want to prevent that because there are patients downstream of a stable, happy, secure, engaged workforce. So really, thinking about nursing well-being is to the benefit of nurses, patients, all of us together. So I think this is something that we need to be focusing on. And of course, COVID really kind of inspired an acute concern about nurses' well-being. I don't know if you've been paying attention to this, but every media outlet probably in the country has had one or more articles related to nursing well-being. This one was super depressing. I read this one a couple of weeks ago. It was published in The Atlantic. Why Healthcare Workers Are Quitting in Droves is the total name of the article. And it was really depressing. Gratefully, the data that I have about Hawaii's nursing workforce don't paint such a dire or dismal picture, but nevertheless, I think that this article really kind of pointed out why the pandemic specifically inspired a lot of concern about the well-being of nurses and healthcare practitioners in general. So I do think this is on a lot of our minds, and that was really ultimately the reason that the Center for Nursing decided that this was something we need to pay attention to. So we decided we were going to pay attention to it. So the way that we learned about the well-being of Hawaii's nurses is that we added questions related to their well-being on our 2021 Hawaii Nursing Workforce Supply Survey. So if you relicensed and you did a long survey at the end of that, that's me downstream of that survey. I really appreciate your participation because it allows us to give presentations like this. So we added a couple questions related to COVID, well-being in general. This is probably the most important and comprehensive nursing workforce monitoring tool that the state of Hawaii has. It's super detailed, collects information about all kinds of things from education to intention to retire, and now it includes well-being. So as part of our normal ongoing workforce monitoring, we felt it was important to include the well-being questions. It is my great hope that I don't have to ask about COVID in 2023, which is the next time we're gonna do this survey. But well-being is something that we're gonna look at on an ongoing basis. On the slide deck, like I said, we're going to email to you when we send out the electronic evaluation form. So all of the clicky things in the presentation, you'll be able to have access to. So there's a lot of information in here you can save for later. So that's really how we learned anything about what we learned. There are some limitations to our data, which I will talk about as we go through the presentation and point those moments out to you. But that's really kind of the context for how we know what we know about nursing well-being and why we decided it was important to ask about it. So having said that, let's find out some of the stuff we learned. So one of the things that we were really interested in learning preliminarily was how did the COVID pandemic, specifically the pandemic, affect Hawaii's nurses? And there were two things that we were focused on learning about. One was, what was the emotional experience of nurses being a nurse during the pandemic? What did that feel like for them? And two, we wanted to know how it affected employment, because there was a lot of kind of national conversation around whether or not nurses were working an excessive number of hours or whether they lost their jobs, because depending on where you were a nurse in the country, either of those two things could have happened. So we were trying to get a good sort of read on what happened to the nurses in Hawaii. So here's what we learned about that. So first thing, there's a lot of graphs in here. If you can't see them well, that's okay. Like I said, you're going to get the slide deck, but I'll tell you what's here. So the top red line indicates the only emotional experience that more than 50% of nurses in the state experienced as a result of nursing during the pandemic. And that emotion was stress. Nurses reported feeling stressed out. 2/3 of all nurses reported feeling stressed out, which frankly, I thought was an underestimate. I was very surprised that it wasn't higher than that. But that's a lot of nurses feeling stressed in the midst of a pandemic. Stress, and we're going to talk about stress too when we get to the well-being questions. Stress is not an uncommon experience for American workers, for healthcare workers, people whose job it is to take care of people on a regular basis. So this is not an entirely surprising finding. So unto itself, we wouldn't necessarily be worried about the experience of stress. It's when we start looking at the other emotional experiences that folks had. So the way we actually asked this question was, how did you feel? And then we gave nurses a list of 27 words, adjectives, that they could pick which one of them they had experienced at any point during the pandemic. The block of red lines that I've identified there for you is the most commonly reported emotions. Between 40 and nearly half of all nurses reported feeling anxious, fortunate, exhausted, overworked, and unprepared for nursing during the pandemic. The reason I think that these being predominant emotions across the workforce is important is because a lot of these are associated with the experience of burnout, stress, anxiety, exhaustion in particular. Feeling overworked or feeling unprepared could be reflections of self-perceived lack of competence, professional competence, which is also an indicator that you're experiencing burnout. So I do think that these emotions in particular do suggest that a fair number of nurses in the workforce are experiencing one or more, in specific in response to the pandemic, experienced one or more emotions that are commonly associated with the experience of burnout. So I do think that that is important to note. But having said that, I also think it's important to note that while mostly negative emotions turned up on our list, but I grant you, the way we asked the question biased it that way. We had more negative adjectives than positive or neutral ones on the survey. We were expecting that predominantly. So in spite of the fact that there were a lot of negative emotional experiences had by nurses during the pandemic, it was also the case that they experienced some favorable ones. And I think that the conversation around how the pandemic has affected nurses has to include the notion that being a nurse during the pandemic was neither a universally nor unilaterally negative experience. Many nurses reported feeling fortunate, useful, compassionate, appreciated, proud. Those are all indicators that people are invested in their job, in the value of being a nurse. And there's commitment there to the profession, even in spite of probably doing nursing during probably the hardest time you'll ever do nursing. So I do think it's really important to note that Hawaii's nurses weren't apparently ravaged emotionally by the pandemic. I think that's a really important takeaway. Now, I do think it's also important to talk about how this affected nurses by settings, because not all nurses in all settings experienced the pandemic the same way. This should not be surprising, especially once I show you the data. I made all the bars roughly the same color except the orange ones. The orange bars represent nurses who worked in the hospitals at the time of the survey. You'll notice that a lot of the orange bars are in some cases substantially taller than the other bars, which means a higher proportion of nurses employed in hospitals are experiencing these emotions as compared to nurses in other settings. We worry about these things because most of them are negative: stress, anxiety, exhaustion, feeling unprepared, feeling unsafe, feeling afraid, feeling sad, helpless, depressed, and traumatized. So when we get to the kind of like back end of this spectrum here, like you're looking at what, just over 20% feeling helpless, depressed, or traumatized. That's still 1 in 5. That's 1 in 5 nurses who work in hospitals, which I would not consider to be an insubstantial proportion of the workforce. So I do think it's important to note that the pandemic hurt. If we're talking about generally using one adjective to describe feelings, it hurt hospital nurses more so than nurses in other settings. This should not be surprising. Nurses who work in hospitals saw the worst of the COVID cases, right? People with most severe, these are the guys who you're seeing patients on vents. These are patients who are passing away in your hospital during COVID protocols that don't allow visitors. So I can imagine why this is the case. So again, not surprising, really kind of consistent with what was going on in the environment, but it does indicate that it's important that hospital nurses make sure that they have resources, that our employers and hospitals are providing with their nurses resources to deal with could very reasonably be considered post-traumatic stress in some cases. I also wanted to point out one more thing which scared me, and that is the compassion. Hospital employed nurses were least likely than nurses in any setting to report feeling compassionate. So we talk about things in vague terms: well-being, burnout, then we introduce words like moral distress and compassion fatigue. This to me indicates that some of that might be going on. You have less than 30%, or it's about 30% of nurses who work in hospitals reported feeling compassionate during the pandemic. And that to me is a little bit worrisome. Being compassionate is kind of an inherent part of doing nursing. And if you can't muster the willingness or ability to do that, that becomes problematic as well. So I do think that while we do have some optimistic data, not all of the pandemic was terrible. We really have some work to do to make sure that our hospital employed nurses are doing okay. Yes, Amy Thomas, I'm delighted to share the slide deck after the presentation. So that's what's going on with respect to the emotional experience of the pandemic on our nurses. I do want to talk a little bit about the employment impacts. While most of the country was talking about nurses working tons and tons of hours or getting laid off of their jobs, 2/3 of nurses in Hawaii reported having absolutely no impact on their primary employment at all as a result of the pandemic. There's a gigantic limitation to this finding, which I'll get to here momentarily. But for the most part, we didn't see those same kind of big swinging changes in employment status or hours worked as a result of COVID. Of the nurses who did indicate that they had some impact to their primary employment, 20% of them, so 1 in 5 of the remaining 1/3, indicated that they were scheduled to work for more hours than usual. We had a few nurses indicating that they were scheduled to work fewer hours than usual. And we had about 5% of the total workforce who was either temporarily or permanently laid off as a result of the pandemic. As was the case with emotions, we also saw variations somewhat by setting. I'm going to tell you in advance, I cannot explain a lot of these findings. If you have insight about this, send it in the chat because I can't actually explain it. It could just be an artifact of who was in the sample. But nurses who worked in ambulatory settings, so that includes all kinds of outpatient clinic type situations, reported being most likely to work more hours than usual, while our long-term care nurses reported that they were scheduled to work fewer hours than normal. And it was our home health and hospice nurses that were most likely to have reported being laid off. Again, I don't purport to have a guess or a reason for this. Amy Thomas is suggesting telehealth probably had something to do with that, and that's very distinctly possible. So other insights on that would be much appreciated, but for the most part, we're not seeing huge changes in employment because of the pandemic. However, two things that I have to note, and I'm going to come to that here in a second. Actually, I'm going to skip ahead a slide and then come back to my questions. One thing is that our findings are limited because of the fielding period, the timing of fielding. Our fielding period went from April to July 31st of 2021. If you are a nurse in healthcare, or you're paying any attention to the epidemiologic curve of COVID in Hawaii, you know that our surge happened in the summertime, started about the 3/4 of the way through July, peaked in mid-August, and then kind of abated by the end of September, which means that our data collection ended immediately before the worst part of the pandemic for nurses. So while our findings may suggest that nothing really happened to the majority of nurses in terms of their employment because of the pandemic, if we would have extended our fielding period, or we would have shifted our fielding period, unbeknownst to us, to that summer surge period or after the surge, we might find very different things. But our fielding period is tied to license renewals. So we are only able to put this survey into the field because we have the coordination of the Board of Nursing and the Professional Licensing Vocational Division of DCCA. If not for them, we don't collect the data at all. So we're kind of bound by that fielding period. So if I would have had my druthers, we would have changed the fielding period, but you can't foresee really when exactly that surge was going to happen. So we have the data we have, and this is why I think it's important to do ongoing monitoring. The other thing is there was no, I'm going to back up to my two common questions since I gave you the limitation. One common question I always get asked when I talk about the well-being data, especially as it relates to COVID, is how many of Hawaii's nurses are at risk for burning out? And I want to give you a number to that question because I understand why you want to quantify it. My answer, though it sounds flippant, it's honest, is that 100% of Hawaii's nurses are at risk for burning out. That's sort of the nature of doing the job. When your job involves caring for other people for hours and hours and hours a day, burnout is a real thing you have to be worried about all the time. If you're asking me how close the workforce is to burning out, again, I can't tell you that. You're asking to kind of oversimplify. Burnout is a really complicated experience. It doesn't have the same trajectory for all people. People don't experience stages in all order. Not to mention there's disagreement, I think, about people who study burnout about whether burnout and moral distress and compassion fatigue are similar, related, whatever. So I can't give you a number. What I can tell you is up to 40% of nurses experience 2 or more of the factors, the emotions that are commonly associated with burnout, but that doesn't mean that they're on the verge of burning out. And I think it's unhelpful really to try and quantify it when really what we should be paying attention to is how do we help nurses identify when they're not doing okay? And what resources can we provide nurses to make sure that, like, I know I'm not doing okay right now. Can I intervene on that before it becomes a conversation about burnout? So I think that's really where the more productive conversation needs to happen. The other common question I get is, how many nurses did Hawaii lose because of pandemic-related burnout? I have not a single data source that can inform this answer. What I can tell you is that none of the data we have available, either from the Center for Nursing, Healthcare Association of Hawaii, any of our employers, individual nurses, nobody is saying that there was a mass exodus of nurses from the workforce following the pandemic. Even now, that's still the case. That doesn't necessarily mean, however, that the workforce is okay, because the other important note that I want to make is that even though there's no evidence to suggest that we lost a huge bunch of nurses, there are a lot of facilities who are reporting staffing shortages. And that is due to a variety of factors, at least one of which is that people delayed preventative screenings or chronic care management. So we end up with comorbid, complex conditions. So we have more people in hospitals than we would typically staff for. So we have less staff than we need. Recruiting nurses to fill those spaces, we just don't have extra nurses floating around in the workforce to bring them in to fill those gaps. So although we didn't lose a whole bunch of nurses to the pandemic, that doesn't mean that we're okay in our facilities. And we really do have to focus on how do we build a more robust workforce that can respond to things like an unanticipated increase in utilization. So that's what I've got on COVID, friends. I do have some data I want to present related to general well-being, if you will indulge me. All right, so overall well-being, like I said, the supply survey is our best tool to do ongoing nursing workforce monitoring over time in particular. So we monitor all kinds of things, like how old are you, right? Because how old you are influences how long you're likely to be in the workforce. What's your highest level of education? Because that influences what kind of scope of practice you might go into. So it makes sense for when we're monitoring those other things to be monitoring things that might impact retention, like well-being. So this is something we've committed to adding to our future surveys. However, in 2021, we were piloting this new question. So we acknowledge that the data were not perfect, and we did that on purpose, knowing that we would refine it over time. So the way we asked the well-being question in 2021 is that we asked nurses if they had ever once experienced each of 8, it's actually 9, I think, events in the past 12 months. And these are things that I talked to my research steering committee about, as well as practicing nurses. What kinds of things are likely to contribute to your experience of wellness and well-being at work? And so this is how we came with the list. More on that, how we're going to revise the questions going forward into the future. So I wanted to present what we learned based on our pilot year of well-being questions. So again, if you can't read these, that's okay. I'm going to get into them in detail. We had 3 items related to stress on the survey because, nursing is stressful. Again, not surprising, somewhat surprising. 70% of nurses indicated that at least once in the previous 12 months they'd experienced stress at work. I would have expected this number to be like 99%. Again, this seems like an underestimate to me. So huge number, but I would not consider this to be terribly alarming. When we start looking at the 2 other stress-related questions on the survey, though, I think that gets at some more interesting information. So the 2 additional stress-related items on the survey were, have you experienced so much stress at your job that you thought about leaving the nursing profession? And 24%, that's 1 in 4 nurses, just about, has indicated that they had so much stress at work at least one time in the past 12 months that they thought, I cannot do this anymore. I'm not doing nursing anymore. What's super interesting about that finding is that when we compare that to people who are intending to leave their job within the next 12 months, these nurses who had thought about leaving their job at least once are actually more likely to stay in their job for the next 12 months than to leave it. My hypothesis about that is if you have a terrible day at work and you think you're going to quit and you manage to get up the next day, come back to work, it reinforces your own commitment to your profession. I can do this. This is okay. I'm in it for the long haul. I'm here. I'm a nurse. This is what I do. So I really think that there's a sort of a self-concept thing that comes into figuring out how to come back to work after a stressful time. Kind of alarmingly, on the other hand, though, is that we also asked a question related to stress. Have you sought mental health services for work-related stress? 17%, so just slightly less than 1 in 5 nurses reported that was the case, which to me was a lot. I have conflicted feelings about that. it's kind of a lot. That's a lot of nurses who are experiencing so much stress that it's affecting their mental health. But if we normalize getting mental health when you feel stressed out, maybe I want to see this number go higher actually. But if you ask these nurses how likely they are to leave their current job within the next 12 months, these nurses are more likely to leave or be more uncertain about whether they're likely to stay in their current job. So when stress becomes so deleterious that it impacts your mental health, this is where we start to see evidence of burnout. People planning on leaving their jobs, not knowing if they're going to stay in their jobs. So it's this, I think we need to find ways to employers to really be paying attention to supporting seeking mental health services, not just when you're feeling so much stress that you have to deal with it, but as a preventative measure. Can we get you enrolled in your employee assistance program to be talking to a therapist once every couple of months just to keep yourself okay? But this is an issue. Catherine is asking me a question. Could this be interpreted as leave my current job versus entirely leaving the nursing profession? Actually, no, because those are two separate questions, but that's a great question, Catherine. So we asked separately. Are you planning on leaving your job right now versus leaving the profession of nursing? So we are able to differentiate those. In addition to stress-related emotions on the survey, again, there's some good stuff we asked about. We didn't want to focus only on the negative stuff because there are things that contribute to the experience of well-being as well, right? So we asked nurses, did you at least once feel valued or appreciated at work? 66% said yes. Fantastic. That's amazing. Do you feel like your management supports your professional development? Slightly less than half said yes. Does your management show concern for your well-being? Again, slightly less than half said yes. So I feel like there are indicators that exist for nurses. Substantial proportions of the nursing workforce are reporting having positive well-being, promoting experiences at work, which I think is important to acknowledge as well. Finally, we have a few things here at the bottom of the graph, which gratefully not super common, but more common ideally than I'd like, especially this bit about physical or verbal abuse by a patient or visitor. 31% of nurses indicated that that was the case, which upsets me. I understand people are sick and scared and they're at their worst. Still not awesome. Have you experienced bullying or incivility at work? About a quarter of nurses experienced that. And then suffering a workplace injury that prevented you from being able to work. About 4% of nurses indicated that that was their experience. Again, when we drill down to these findings by setting, the reason I color the graph this way was to make the point that there's a lot of variation by setting. So where we were looking at the COVID data, there was a very clear pattern that hospital nurses were affected differently by the pandemic than nurses in other settings. That's not really the case for our well-being data. There's a lot of variation in what impacts, what nurses in various settings experience on an ongoing basis. I would point out that there are places, the hospital nurses again are the red bar. There are some places where hospital nurses are more likely than nurses in other settings to experience certain things like bullying and civility, verbal or physical abuse by a patient, or an injury. But otherwise, there's a lot of interesting stuff going on. The implication for that, in my humble opinion, is that there's no one-size-fits-all promotion for wellness across all settings. What that means is every employer in a different setting needs to figure out what works for their nurses, how to promote their well-being, how to prevent their stress, how to help them manage their experience of inevitable stress. And you can't create the same solution for long-term care as you do for hospitals because the data say so. Let's talk about long-term care for a second, because this stressed me out. We've heard for a very long time from our employers in long-term care that they struggle with turnover. And now I think we have some data to suggest why that is the case. When we look at the data from the well-being question, we find that nurses employed in long-term care settings are least likely to report feeling valued and appreciated. Less than 40%, less than 30%, I don't know, somewhere between 30 and 40% of nurses at any time, even one time in the previous 12 months, felt valued and appreciated at work. That to me is abysmal. They're also least likely to report feeling that their professional development is supported by their management. Take our Hawaii State Center for Nursing Evidence-Based Practice internship for clinicians, for example. Very easy for us to get acute care facilities to send their nurses on over. We have a hard time getting long-term care facilities to send nurses, even when we fund it. So that's just one very tangible example of how that there's a difference in the support of professional development by setting. We also, when we drill down into other data not presented in this presentation, but we do talk about it in our report that's available online, that long-term care nurses are most likely to report leaving their current job within a year due to job satisfaction. So when we ask them, why are you planning on leaving your job within the next year? They will tell you it's because they're dissatisfied with their job. Not to mention when they report their job satisfaction, it's extremely low. Again, most long-term care nurses are most likely to have a 5-year plan that involves moving, working to in another setting. They want to go from long-term care to, surprise, surprise, acute care. So we have issues with how to retain the workforce in long-term care. But what I think now we have are data about why. So if we can focus on trying to figure out how to improve that feeling of value and appreciation and how to better support professional development aspirations of long-term care nurses, maybe we can change those other variables and create more stability in that segment of the workforce. As usual, there's a couple of important notes I feel the need to provide on these data. The way, like I said, this was a pilot year. This is the first time we were asking about well-being. So we know the question needs refining. What we were able to learn in 2021 was how pervasive each one of these experiences are. How many nurses in the workforce report experiencing each one? But what we don't know from the way we asked the question was persistence or frequency. There's a time component to that. So when you experience something that is well-being promoting or something that chips away at your well-being on a persistent, ongoing, or frequent basis, that has a qualitative difference in how you feel on an everyday basis at work. So next time when we ask the question, we've got to add a time component to that. I haven't quite finessed exactly what that's going to look like, but there will be a modification to the question to include time. Also, we've already identified variables that might be more important to measure than the ones that we actually did measure. This survey serves a lot of purposes. It contains a lot of data points. On average, nurses spend 13 minutes taking this survey. So we can't ask every question we want to because we just can't do that to our nurses. So we have to prioritize. So we've got to spend some time figuring out what components of well-being become important to measure over time. And they may change over time, but I'm almost reasonably certain that we're going to change up some of the metrics that we collected this year for next year. And by next year, I mean 2023. So that's what we know about general well-being and by setting. So I do want to spend the last little bit here talking some about short and medium term retention. So we ask 2 retention related questions. One is, how likely are you to leave your current position within the next 12 months? Green is stay, red is leave, gray is I'm not sure. As you can see from the pie chart there, about 62% of all nurses indicated that they were likely or very likely to stay in their current job for at least the next year. Fantastic. That suggests stability. We don't have to worry about turnover when people intend to have like at least a short range plan of staying where they are for at least the next year. Fantastic. But if you look at our bar chart, which separates people by setting, you'll notice the bar with the shortest green segment is long-term care. So that's again consistent with the data that I was just talking about with respect to there being differences by setting, and our long-term care sector is least stable amongst the entire workforce. When we ask people what their plans are for 5 years down the road, it's these, I want to draw attention to these 3 bars here. So you're going to be working in another field, retired, or leave the workforce for some other reason. If you add those across, you're looking at about 22% of nurses who are indicating that for one reason or another, they're going to not be nurses in Hawaii anymore. If you take that 20-ish% and divide it over 5 years, that's a sort of like anticipated estimated loss of about 4% of the workforce per year on average. That is reasonably consistent with DLIR's projection about how the workforce separations from the workforce. DLIR's projections are not way off from ours, and they project that overall there's going to be a net increase in the size of the workforce. So we're not super worried about losing 4% per year. People retire, they leave, they PCS out with their spouses or whatever. We have this, by the way, the percentages don't add because it was a multiple select question. So you could indicate more than one of these if you wanted to. About 45% of nurses indicated that 5 years from now, so by 2026, I'm probably going to be doing what I'm doing now. Again, an indication of stability and no indication of real significant shrinking. We do see a lot of anticipated migration within the workforce, so people moving to a different setting and or picking up a different specialty. We do have a fair number of nurses who are unsure what their 5-year plans are, and that's to be expected. People are terrible. There's an enormous amount of psychology research to suggest that people are terrible at predicting their own futures. So I'm not surprised that people admit that I have no idea what I'm doing. That's not a problem for me whatsoever. So again, overall, when we take these data together, we don't really have any cause for concern that we're going to see an exodus of nurses or a shrinking of the workforce or any more instability that already exists, especially in our long-term care sector. But it doesn't mean we should be complacent. I think more than anything, these data suggest that we know where we need to help improve the well-being, the appreciation, the value we show to our nurses so that they do feel good about their jobs and want to continue to stay. That is pretty much all I have to say about the graphs there. I did kind of note all of these important notes already in the course of presenting the graphs. So again, DLIR, our data kind of match DLIR's best projections, which, you know, there's criticism about DLIR's projections sometimes, but they are the best, I think, that we have. We are anxiously awaiting Healthcare Association of Hawaii's updated demand survey, which is really going to give you our best data about how many openings there are in nursing and whether or not we have enough nurses to fill those openings. That is going to come out in 2023. We're looking forward to that. So that'll give us better indication as to whether we have a sufficient workforce. And again, because of the limitation about when we collected the data, we don't have information about how nurses' plans might have changed since we collected these data because of the surge. And again, overall stability in the workforce is not going to stop that high turnover problem in long-term care. I've got a question here in the Q&A. Was there any information about whether nurses felt like they were adequately compensated? I did not ask that question, and it is one of the ones that has come up since we did the survey about whether or not we asked the right questions related to well-being. We did, however, collect salary information. So we do know that there is a difference, and I'm not going to cite it to you off the top of my head. I don't want to get it wrong, but it will be in our big report. That compensation does vary somewhat by setting, and that could be a contributing factor to the turnover issue in long-term care as opposed to acute care settings. So that's a great suggestion and a note. Any other questions? Feel free to drop them into the Q&A. Otherwise, I'll jump ahead to our last bit here, which is me providing you some information about where you can get more information. So like I said, I'm Carrie, I'm the workforce researcher. One of my very favorite things on earth is when somebody calls me up and says, hey, Carrie, do you have data about this? Almost always the question is no, but I know where you can get it, or I can get something close to it. Because again, we have a limited ability to collect information about the workforce. But if you want to talk to me about data, what we have, what we know, what we don't know, what we should know, please send me an email, give me a call. I'm happy to talk to you. All of our reports are posted on the Hawaii State Center for Nursing's website. We have a workforce work research page dedicated to all of our reports. So you're going to find the method for the supply survey posted there, as well as the report that includes all of the data from this presentation. So there's graphs, there's data tables, and there's a discussion of kind of the interesting things that we found. This was a big overview. There's a little bit more detail in the report. So if you're interested in more information, I would highly recommend that you go visit that. If you haven't found us on the socials, we are on Twitter, Instagram, and Facebook. Please make sure that you put hscfn@hawaii.edu on your safe sender email list, because that is where you're going to get the evaluation from. So if you're interested in collecting proof of completion for C&E purposes, that's the email that the survey is going to come from. And again, even if you don't want the proof of completion, we appreciate your feedback anyway. And we will be including the slide deck with that presentation. So for those of you who are asking about that, happy to provide that. And again, I would encourage you to go take a look at our report online for more information. Question just came into the chat, union and long-term nurses. Robin, if you want to unmute yourself and clarify that question for me, maybe that would be helpful.
Yeah, I was just asking about like union. You know, you have to be in the union for hospital nursing. And I was just wondering if union could be for long-term care nurses. Do they have to be a member, or are they represented with the union?
That I don't know the answer to. If somebody knows the answer, I would be delighted for you to pop in with that.
Because that might, you know, contribute to the differences in salary.
That does seem plausible, and now you're making a good point. I have never asked on a supply survey whether or not a nurse is in a union or represented by a collective bargaining agreement, and that might make a difference. So I do think that that's an interesting question. Food for thought. I appreciate that question. And yes, I do think that compensation, union representation, collective bargaining, I think are all an interwoven conglomeration of variables that definitely impact the feeling of value. But it's also the case, compensation definitely does matter. But at some point, you can pay me all the money in the world, and if it's still terrible to come to work, I can't do that in the long run, right? I'm not a nurse, I'm not a clinician, I've never worked in healthcare settings, but I have absolutely positively left decently paying jobs because, oh my God, I just could not even. So I do think that while compensation matters, it cannot be everything. So I think that there's a convergence between, are you being appropriately compensated for your skill and the difficulty of the job? Are you being compensated fairly for people doing similar jobs in other settings? And also, does doing what you do and coming to work give you that feeling of, this is worthwhile for me to do something? This is feeding my heart, it's feeding my soul. It is what I expected to do when I started nursing school. So I do think that all of those things ultimately factor in.
Carrie, this is Amy. I want to say that, we have on island, both unionized and non-unionized hospitals, and typically the non-unionized nurses are higher paid than the unionized nurses, I believe, across the state. So I don't know that that's a factor.
Super interesting. I was not aware of that fact. That's good to know. See, now you guys got me thinking about, I got to ask about union, if you're collective bargaining. I don't know how to ask that question. If you guys have tips on how I can ask that question to nurses on the survey, please send me an email or send it in the chat. I would appreciate that. Catherine Finn Davis is asking how we ask the nurses, especially long-term care, what would make them feel respected and valued at work? We assume it's the money, but have we actually asked that question? I haven't. I have not asked that question. I asked the question of, do you feel valued and appreciated, but not why? And so I feel like, again, the ability for the supply survey to be the tool to get at all of the really nuanced information that allows us to do really strong, robust interventions is limited. We ask so many questions about the entirety of the workforce. We can't get to the detail, I think, sometimes that is necessary. So I really feel like we've created a jumping off point. So we know that our long-term care nurses are saying, I don't feel valued, I don't feel appreciated, I'm unhappy, I'm dissatisfied with the job. If the long-term care facilities see those data, I would hope, it would be my great hope and expectation, that the DONs at long-term care facilities would be like, yo, what do you guys need? How can we help you? That, I think, would create a more effective, workable intervention. And again, it's not a one-size-fits-all scenario, and I don't think that it would be helpful for us to think about it that way, but I do think that the employers, and I've had conversations with a lot of the hospitals, that they're specifically working and focusing on improving nursing well-being and helping nurses manage stress. I don't know whether or not the long-term care facilities are doing that, only because I don't talk to quite as many long-term care facilities, but I do think there's an opportunity there for us to share those data and help guide some of their responses. Other questions? If not, I appreciate you all being here. You have been a delightful and engaged audience. Much appreciated. Clem, thank you for the validation on that. How much does it mean to you? You all being here makes my work feel meaningful to me. So thank you so much. We wish you all very happy holidays. We'll see you in January. Aloha.
And that concludes the content for this continuing nursing education activity. All participants who wish to receive continuing nursing education credit for participating in this activity must complete the electronic evaluation provided on the Hawaii State Center for Nursing's CNE webpage. The link to that webpage is in the description of this video. We would highly encourage all participants, regardless of whether you want proof of completion, to finish the evaluation. Your feedback we take very much into consideration, and it helps us to continually improve our educational content. Please be advised that the evaluation survey is password protected, and the password is provided on the next slide. When you access the link to the evaluation, it will prompt you for the entry of a password. The password is case sensitive. You will need to enter the following: capital C, capital E, _47 _ 010122. Again, for those of you who are listening rather than watching, the password for the survey is capital C, capital E, _47 _ 010122. And again, that password is case sensitive. Thank you so much for your attention today. We hope to see you again at a future Hawaii State Center for Nursing continuing nursing education activity. Mahalo.